Hey there, welcome to today's Explainer. I'm so incredibly glad you could join me. Now, I want you to think of me today as your supportive doctor and consider this Explainer your brand new patient consultation. Today, we are going to talk about your body's silent sentinels. These are two incredibly vital yet, honestly, profoundly underappreciated organs that literally work around the clock to keep you alive and thriving. We're talking, of course, about your kidneys.
So let me ask you something right off the bat. When was the last time you actually thought about your kidneys? If you're like most of my patients, the honest answer is probably, well, rarely, or maybe even never. And you know what? That's entirely normal. We rarely think about these two little bean-shaped organs tucked away in our lower back until a problem pops up. But as you'll see today, waiting for a problem to happen is exactly what we want to avoid.
All right, let's jump right into Section 1. Meet your body's filters and understand your baseline.
I've found the absolute best way to understand this is with a really simple analogy. Think of your kidneys as your body's continuous water treatment plant. Right this second, as you're hanging out with me, your kidneys are quietly and efficiently filtering waste products and excess fluids right out of your blood. And they're turning that waste into the urine that eventually leaves your body. It is an extraordinary, completely non-stop purification process.
But here's the wild part. They don't just filter waste. These organs do an incredible amount of work behind the scenes to keep your entire body in perfect balance. Beyond just getting rid of excess fluids, your kidneys actually regulate your blood pressure. They balance crucial electrolytes, things like sodium and potassium. They even support the production of your red blood cells. And they maintain the precise fluid balance your cells literally need to survive. When your kidneys are doing their job, your whole body is just humming in perfect harmony.
Moving on to Section 2. The danger of silent progression, and why we actually worry.
Look, the main reason the medical community worries so much about this is that many people may not experience symptoms during the early stages. This is the real danger of silent progression. Because your kidneys are such incredibly resilient workers, they'll just keep pushing through damage without sounding the alarm. So by the time you actually feel sick, significant, sometimes irreversible damage might have already occurred to your internal filtration system. And this brilliantly illustrates the two leading causes of that hidden damage worldwide. We've got diabetes on one side and high blood pressure on the other. See, when blood sugar levels remain high over time with diabetes, it physically damages the delicate, tiny blood vessels inside the kidneys. On the flip side, uncontrolled high blood pressure acts kind of like a pressure cooker. It places this excessive strain on the kidney tissues themselves, gradually reducing their ability to function properly.
So let's get into the diagnostic part of our consultation with Section 3, spotting early warning signs and what to watch for. Even though those early stages are sneaky and quiet, your body does occasionally leave us some subtle clues. Here are the common early warning signs you should never ever ignore. We're looking at persistent fatigue, maybe some unusual swelling, like puffiness in your feet or your face, or finding blood in your urine. You might also notice frequent urination, especially if you're waking up multiple times a night. Muscle cramps, nausea, and even having a hard time concentrating are also on this list. Oh, and remember how we just talked about high blood pressure causing kidney damage? Well, high blood pressure can actually be both a cause of kidney disease and a warning symptom that your kidneys are already struggling.
Now here's a very specific warning sign to look out for: foamy urine. Imagine making coffee, right? If the paper filter tears, what happens? The thick coffee grounds end up right in your cup. Well, foamy urine is exactly like that. It means the kidney's delicate filtration system is essentially broken, allowing vital proteins that belong in your blood to slip right through into your urine. If you see this, it's basically your body waving a giant red flag.
So how do we stop that filter from breaking in the first place? Let's move to Section 4, everyday habits to avoid and what to stop.
Okay, so there are the usual everyday vices we know we should moderate, right? Excessive salt intake, chronic dehydration, smoking, heavy alcohol use, and the frequent misuse of everyday over-the-counter painkillers. But there's also a major hidden danger in things you might mistakenly think are healthy or cleansing. I'm talking about unregulated herbal mixtures and unknown detox products. These can cause severe, totally unrecognized damage to your kidneys. Please always consult your doctor before taking unverified supplements.
Let's flip it around. From what to stop to what to start in Section 5, your daily health checklist.
Here is a highly empowering daily checklist you can start right now. Step 1. Drink adequate water daily to support normal function. Step 2. Eat a balanced diet.
We're talking fruits, veggies, whole grains, and healthy proteins. Step 3. Maintain regular physical activity. This one is absolutely crucial because it directly supports healthy blood pressure and blood sugar regulation, which, as we know, are the two biggest threats we discussed earlier. And step 4, avoid smoking and actively limit your alcohol intake.
And building on that dietary advice, reducing processed foods and limiting excess salt are just vital steps to reduce unnecessary strain on your kidneys. By eating a balanced diet full of heart-healthy foods, like all those fruits, vegetables, and whole grains we just listed, you naturally protect your kidney function. You are quite literally easing their daily filtering workload, which they definitely appreciate.
Now, because we can't just rely on how we feel, we really need Section 6, routine tests for long-term health, and how we monitor.
Here are the exact routine tests required at your annual medical checkups. We need consistent blood pressure monitoring, blood sugar testing, basic urine tests, and specific kidney function blood tests. Because kidney damage is so silent, these yearly checks are the only definitive way we can monitor your baseline and catch problems early, long before severe, irreversible complications have a chance to develop.
And that brings us to a slightly sobering, but ultimately super hopeful truth. Kidney disease is not always reversible. The damage can sometimes be permanent. However, early detection through those annual routine tests we just talked about, combined with proper management, can significantly slow its progression. Being proactive about testing drastically improves your long-term quality of life. You literally have the power to protect your future.
I want to leave you with this fantastic final thought, straight from our source material today. Healthy kidneys quietly protect your body every single day. Taking care of them is not something to postpone until symptoms appear. Prevention, awareness, and making those healthy everyday choices we talked about today truly remain your absolute strongest tools.
So, here is my final question for you as we wrap up our little consultation today. Will you start protecting your silent sentinels today? Go grab a glass of water, keep an eye on that blood pressure, and make sure you schedule that routine checkup. Thank you so much for joining me for this explainer, and please take really good care of those amazing little filters of yours.